Myotonic dystrophy, also known as muscular dystrophy or MD, is a disease that affects the muscles and causes progressive muscle weakness. There are two forms of MD, type 1 and type 2. Type 2 symptoms tend to be milder. Signs and symptoms of MD are muscle weakness, stiffness, tightness, and wasting. MD affects smooth and skeletal muscles, such as the eyes, causing cataracts, the heart, that may cause cardiac conduction issues, which could be atrial fibrillation, atrial flutter, that may require pacemaker or defibrillator placement to correct the cardiac conduction issues. MD can affect the endocrine system, such as thyroid issues or blood sugar issues. It may also affect the central nervous system to include mental deficits. MD can also affect the respiratory system, causing decreased lung function. It can also affect the gastrointestinal or GI tract to include GI absorption issues, GI motility issues, swallowing issues, and possible constipation. MD also causes general muscle issues. MD is an autosomal dominant inherited disease. It is a genetic mutation of gene myotonin protein kinase DMPK and or cellular nucleic acid binding protein CNBP. MD is diagnosed by physical exam with muscle weakness and or muscle wasting, laboratory testing for elevated levels of muscle enzymes, electromyography or EMG testing to determine electrical activity of the muscles. A definitive diagnosis is blood or saliva to confirm mutation of gene DMPK and or CNBP. Treatment of MD options could be physical therapy to maintain muscle strength and endurance, pain management, orthotics for muscle weakness, pacemaker for cardiac electrical disturbances, routine ophthalmic exam with removal of cataracts if needed. Some assistive devices that may be necessary could be a wheelchair, walker, and or cane. Genetic interviewing questions related to DM could be a family history. That goal would be to go back 2 to 3 generations of any visual problems such as eye surgeries, corneal transplants, corneal lens replacements, and or glasses or contact requirements. We should also be asking of any cardiac problems such as sudden onset of cardiac death at a young or old age, cardiac conduction issues, fast heartbeat, slow heartbeat, or irregular heartbeat, surgeries that required a pacemaker or defibrillator placement, and family history with children of congenital heart defects at birth. We should be asking of any family history of endocrine problems such as non-insulin dependent diabetics, insulin dependent diabetics, thyroid levels high or low, serum calcium levels high or low, any infertility issues, or growth hormone levels that were high or low. We should be doing a history of any central nervous system problems within the family, hopefully 2 to 3 generations back, such as mental retardation, low IQ, dementia at an early age, unexplained sleep disturbances, mood disorders, which may include anxiety, depression, and or bipolar disease. Any family history of respiratory problems such as decreased respiratory function, issues with pneumonia related to aspiration, oxygen dependence, need for mechanical ventilation, or children born with respiratory compromise. Is there any family history of GI problems, such as constipation, diarrhea, malabsorption of food, swallowing difficulties, intestinal obstructions, and/or gallbladder issues? Any family history of general muscle problems, such as decreased muscle tone, muscle wasting, general muscle weakness, poor muscle growth, issues with balance related to decreased muscle tone, inability to walk and/or wheelchair bound at a very young age, inability to play sports or participate in general play at a young age.
Hello, this is Dan. I just want to say thanks for watching this myotonic dystrophy presentation that Stacy and I are doing. This is part 2. Hope you enjoy. What can nurses do for those with or at risk of a genetic disorder such as myotonic dystrophy? First and foremost, we have to acknowledge our importance as provisionaries of genomics. Being a nurse puts us in a valued and unique position because we are in the front lines of patient care. We are the patient advocate. We learn from the patient. We document from what the patient states. We are trusted healthcare professionals and make unique contributions to the field of human genetics and genomics and complement the work of other healthcare providers to improve health of the public. Also, nurses are well positioned to incorporate genetic and genomic information across all aspects of the United States healthcare system. And the nursing profession is a pivotal provider in quality healthcare services and is essential to closing the gap between research discoveries that are efficacious to healthcare and their successful adoption to optimize health. We talk a lot about genetics and genomics, but what are some of the genetic influences on health that we are trying to fight against with genomics? Well, in males, 8 of the top 10 leading causes of death have genetic or genomic components to it. And in females, 9 of the top 10 leading causes of death have genetic and genomic components to it. These include cancer, heart disease, Alzheimer's disease, stroke, diabetes, kidney disease, liver disease, respiratory disease, pneumonia, and septicemia. And these are important because in illnesses such as myotonic dystrophy, patients are susceptible to some of these diseases as well, such as cancer and heart disease. And I'll show that in a later slide. This slide is basically a breakdown of the previous slide I was talking about of the genetic influences on illnesses. As you can see in males and females, here is a breakdown between like heart disease and cancer. It gives you percentages. And you can see that it's pretty significant. How do we as nurses become provisionaries in genetics and genomics? Well, it's about education, all kinds of learning. Continuing education as far as advanced practice nursing and genetics. Leadership persuasion. Talking to your higher-ups, your bosses, about policy review and development and promoting genomics within the facility, within your organization. Credential training. Not everybody can be a nurse practitioner or a doctor or even get a master's degree, but we can be credentialed. We can learn about genetics and become credentialed in that and become a nurse that is credentialed in genetics. We can also join organizations that promote genomics. International Society of Nurse and Genomics, Global Genomics Nursing Alliance. These are very important, very useful resources in knowing about genetics and genomics. And of course, education, proper health assessments that we learn from our patients. Personal, family, generational histories, at least 3 generations, if not more, is important so we can gain that knowledge, so we can enter that and we can learn from it. How do we take what we learned from genomics and implement it? Well, first we have to understand ourselves. We have to know our own stances and our own beliefs on certain topics, such as genomics. But however we feel, we have to put those feelings aside, whether they're pros or cons, for the best interest of our patients. Because we are, after all, a patient advocate. We have to know the law, autonomy, privacy, informed consent, capacity of making decisions. We have to know diversity. We have to know something about our patients, race, religion, culture. We have to know where they're coming from in order for us to understand where they're coming from with their decision-making process. We have to be accountable to our patients. We have to be knowledgeable about their condition. We have to be forthcoming with information about their condition when asked, which means we have to be honest. And then we have to be supportive and compassionate. But again, important, we have to be an advocate. We work for the patient. We are their voice when they cannot be. As that patient advocate, we have to make recommendations to the patient. We also have to make recommendations to the doctors. And due to the fact that the muscles that are affected by this type of illness, treatment recommendations would include a baseline neurological test, therapy, both emotional and physical, pain management. This is a debilitating disease, and it's very painful. Pain management can be crucial. Regular exercise for muscle weakness, whether that be light training, aerobic training, active and passive range of motions, depending on where they stand in the development of the condition. Cardiovascular training, heart, respiratory. These again are muscle-related diseases, and your heart and your respiratory and your lungs are affected by this. So jogging, walking, active passive range of motion, anything that will strengthen the muscles is going to be important. And also, as an advocate, we have to make referrals for our patient. Who would the patient benefit talking to? A chaplain, for one, for spiritual guidance if warranted or even wanted. But we have to make that decision based on the patient's needs and wants, not on our own. Personal and family therapy. This is not just a personal disease, this is a family disease. Family is affected as well. So therapy might be beneficial for both. Genetic counseling, and I'll get into that in a little while. Neurology, baseline cognitive and neurological functions, cardiovascular, ECG, respiratory, pulmonary functions, endocrine. The thyroid is often affected, along with blood sugar in myotonic dystrophy. Ophthalmology, eyesight, cataracts, physical and occupational therapy, as I mentioned before, and of course nutritionists. When patients are in pain, they don't want to eat. When patients don't want to eat, they get weak. Muscle breakdown. This is important when muscles get affected by this disease, to have as strong muscles as you can. As I mentioned earlier in the breakdown slide, myotonic dystrophy also has other diseases that are associated with it. Because this illness has a genetic component, being genetically tested for those diseases is very recommended, such as cancer, diabetes, cardiac issues, and pneumonia. Also, immediate offspring would also be recommended for genetic testing, and siblings of the patient and their immediate offspring should also be tested. When it comes to knowledge, information is crucial, whether that be information on a paper chart, electronic record, personal healthcare record. Informatics is crucial in the promotion and development of genomics. Accurate and timely documentation is the key to the ongoing understanding of genetics and continued development of genomics. This ever-growing database, such as the healthcare record, is crucial in the knowledge and will continue to benefit healthcare professionals in how we treat our patients, but also in the successful outcomes from their treatment. Well, there you have it, myotonic dystrophy. Stacy and I want to thank you for taking the time to watch this presentation, and I hope you learned something from it. Thank you.